So can you confirm that you can hear me? Can you confirm that you can hear me and that you can see the screen?
Yes, please. It's loud and clear.
And you can see the screen, right?
Yes.
All right, good. Yeah, so we are going to look at marketing in healthcare, and this is our first session. So we are going to learn about healthcare marketing and what it is. The other thing that we shall look at is the evolution of healthcare marketing and why there is a resistance to marketing in healthcare. And then we'll look at the unique features of healthcare goods and services, and then the types of healthcare organizations where we can practice healthcare marketing. So marketing is the process of creating, communicating, and delivering and trading offers for the values of concern of customers, clients, partners, and society as a whole. Okay, so this definition of marketing basically tells us that we have offers that we are offering, that we are presenting to potential clients or potential customers or partners, or the offers that we are providing to a community or society as a whole. Okay, so healthcare marketing comes from marketing. Okay, so that means that if we are practicing the process of creating, communicating, and delivering and trading offers for the values of customers and clients in the healthcare industry, we are practicing what you call healthcare marketing. So, of course, we shall look at the nature of healthcare organizations and the nature of customers that healthcare organizations look forward to attracting. And then a market is a place where buyers and sellers gather to facilitate the exchange of goods and services. So marketing has, apart from the fact that you present or give an offer to clients, it has other associated functions. Okay, some functions such as supporting medical center-wide financial functions. Okay, this is to say that if for example you're operating a health facility, you need to make it very easy for the client to be able to make financial operations or financial functions. Okay, so it is part of marketing. So for example, if you're offering medical services, and then there are modalities of payment such as Visa payment, mGrosh, and others. You putting on, making sure that these financial options are available is actually part of marketing. Okay, if you include these modalities, you're going to increase sales, and basically this is marketing. And then we have what you call operational functions, which is ensuring that we produce the goods that we are offering to the market, and also be able to deliver the services that we have. The other part of marketing also is about providing knowledge or teaching people about how to use a particular product. or teaching them about a given service that is offered within a health facility. Okay, and then we have what you call promotional functions, which include basically selling, detailing, marketing and advertising, promoting and building brands. Okay, okay, so we move forward. So traditionally we had what we call um, traditional marketing techniques. These are ways in which marketing was actually done. But these days, marketing is completely different. As we shall look at the evolution of marketing. Traditionally, that people focus on what you call public relations, making sure that you have transparency in the way you interact and share information with the public. It's what we call public relations. And then also communicating about the various products that you have. It is not enough to always say, this is what we have. No. If you only focus on saying this is only what we have, basically communicating to people what you have, that is a traditional way of marketing. Okay, so you need to do more in terms of marketing. And then we have community outreach. Okay, vaccinations. If a hospital organizes an outreach and then they do vaccinations, deworming, okay, and some simple medical checks, that's an example of a marketing technique that is also that can also be categorized as being traditional. And then ensuring that you have very good relations with the government or the authorities. That is also very important. We have networking and then sales promotion, which is ensuring that you have sizable sales that you make. Okay, you organize sales promotions and people buy the products that you have. Advertising through the normal or the usual channels like television, radio, and the rest. And then also meeting people and then selling them or making them buy your products, what we are calling personal sales. And then the other one is you having access to, let us say, emailing database, and then you send people information about the products that you have just because you have a database for emails. Okay, that's also another what you call database marketing. And then you have direct marketing, where you meet someone, tell them this is what I have and I want you to buy. And then we have what you call customer relations marketing, making sure that a person who has come to your facility and actually has bought or has received a service from you, you maintain that relationship with them. Okay, that means that when the next time they need the kind of service that you want, they will always easily come back to you. And then we have what is called social marketing, which is basically selling a product or a service that will basically benefit the person or the community or group of individuals using the traditional marketing principles. But usually in this case, your marketing adoption of good or what you call healthy or positive health behaviors. That is what we call social marketing, and something that we shall look at in details. So when you're marketing, you need to know your niche. That is to say, you need to know who you want the message to reach to. Okay, So that's what we call target levels. Who do you want the message to reach to? Is it the whole public? Is it a given segment of the public, or is it are you marketing to specific people who have specific characteristics? Okay, so those are the different levels: mass marketing, target marketing, and then micro marketing. So with mass marketing, you basically, it's a wide category of individuals. Like you have a diverse audience. Okay, you're speaking to everyone. You want to reach. You want your message to reach to everyone. So that is what we call mass. Okay, so that means that you are not targeting any individuals, or you're not targeting people with certain characteristics. Okay, so you have a broad category of people that you want to receive information about the products that you have. Then we move to target marketing. This is what we call it's a bit what we can call segmentation. Okay, segmentation in marketing, that you need to categorize the people into categories of what we call segments, and then tailor your messages to what these groups could identify with. Okay, the preferences of individuals may not be the same. So you need to know that the people in a specific group, what are their preferences, and then you write, or you market to them using messages that are important to that segment. Okay, because you want your message to be received well, and an action has to be taken. So if you don't craft your marketing very well, it will not appeal to specific audiences. Okay, so that is target marketing. You need to have categories of the public that you want your message to reach to. If you're talking to a 15-year-old, it's not the same way you're going to talk about someone of 80 years and having diabetes. Okay, you can't send a message about a modern way of managing prostate cancer to someone of 15 years, because prostate cancer is actually very prevalent amongst, is higher. The chances of getting prostate cancer are higher in older people than in young people. So the young people could be interested in other things that the old people could not be interested in. So that is what you want. You want to make sure that the services that you are providing in the healthcare organization may be preferable to people of a certain gender, certain age, certain income group. If you're going to market about breast cancer screening services in your facility, you can't market that to men, because really the highest percentage of breast cancers occur in females than in males. Or maybe let us say you can't market cervical cancer screening to men, because men don't have the cervix. Okay, so that's why target marketing is very important. And then we have what you call micro marketing. This is about being highly personalized and having what you call a niche oriented marketing approach. A niche is you can explain a niche as a section of services, or a collection of services that you want to offer, and that those are the services that you're concentrating on. That's what we call a niche. That for me, I'm going to create a hospital, but this hospital is going to put a lot of emphasis in NCDs, the non-communicable diseases. So that is a niche that you have really established. Okay. So when we say highly personalized, is that we want to be very specific about the people that we want to communicate to. We really need to know them more, and we use data, customer data, to know who they are, and then deliver messages to specifically address their needs, or the kind of products that they could actually need. Okay, so that means that it is more narrowed. Okay, is, for example, you want to you want to promote a gynecological procedure that increases the likelihood of conceiving. Okay, maybe someone has what you call secondary fertility, infertility, I mean. So that means that for you to be able to market this new technology in managing secondary infertility, you might need to market this technology to someone who has ever asked the question about the causes of infertility. So by the time I send you this, that you see, we have this procedure which can help increase your chances of conceiving. And I'm sending it to someone who has ever asked that question on the internet. This is more specific. Some of you have seen this with your social media feeds. When you're scrolling, maybe you have not liked the page, then you don't follow the page. But as you're scrolling, you take like 1 minute looking at a post from a specific page about a specific topic. The next time you scroll, you see a lot of posts that are related to the content that you have read before. It's because they have known that this is your interest. This is what you want. And they will always make sure that you have on your Facebook feed, you see a lot of these same things. So it's basically this. When you go to Google and search for something, Google collects this information. When you advertise on Google, Google will know that you are the person who had asked about the management of secondary infertility, and then it will give you that advert. That is highly targeted. So you know that you are presenting your product or service to the people who are actually who have ever asked about that, and you're basically addressing that. So for example, if you are marketing our online courses, we can make sure that anyone who has ever asked about online universities in South Sudan gets that message. So that is micro marketing. So it is from marketing that we get what you call healthcare marketing. So for us to look at how healthcare marketing has changed over the years, we really need to look at how marketing as a broad specialty evolved. over the years. So here we're going to look at the 4 eras where you can classify or the phases of marketing generally. The production era, sales era, marketing era, and then the relationship era where we are currently. Production era. This was during the Industrial Revolution, okay, where really people wanted goods. As long as you produce the good, I want it, and that's all. So your role as a marketer is to deliver this good to the person who needs it. This was the production era. The next era is what you call the sales era. Okay? This one now emerged as a result of competition. Everyone was having a product to offer to the potential customer. Okay? Now, for you to beat this competition, you need to take into consideration what the customer actually wants. It's no longer about you designing the product. It's about you making sure that the product actually matches the needs of the customer. So this is where we moved to what we call customer-centric approach. Okay? So this one means that the marketing became more aggressive to convince customers to purchase products because the products are already there. That means that the powers are now with the customer. The customer has to make a choice on which product to buy. So if you are the marketer, you need to make your product outstanding. And to make that product outstanding, it means that you need to take into consideration the needs of the customer. So emphasis was placed on making sure that you sell more goods or more products to the customers. So you persuade people, you make promotional offers to make sure that you sell more. And then the third era is the era of marketing. Okay? The thinking about marketing started to change in the mid 20th century to the late 20th century. So here, it's not about making sure that you put the good toward, you deliver the product to the customer, but more methodologies or comprehensive approaches were now considered, where the emphasis is on ensuring that you reach the market that actually needs your services or your product. And what are they thinking? So this is where you do things like market research. Okay? Understand what the market is like. Conduct studies to understand that. And then segmentation, dividing people into groups and see what their needs are and whether you can modify the products according to what they could really want. And then targeting and positioning factors. These are very important. So this is where now marketing became advanced, becoming a little more complicated. It's not only about delivering the product, but also making sure that you really have to improve on your marketing by conducting research, segmentation, targeting, and positioning. There's, of course, if you do that, they will help you in identifying what the customer wants and then respond appropriately. This will enable you to beat the competitors. Okay? So this is an area where more and more was actually coming out of marketing. Okay? This is where the focus was no longer about making short-term sales. It's about building loyalty building brands through effective customer management and communication. Now, the last one, which we are in now, which started from the late 20th century to the present, is the relationship era. Okay? Relationship era. Where it's not about buying the item. Your interest as a seller is not only to make sure that I buy the product or pay for the service, but it's about establishing strong customer relationships. Strong customer relationships. What is that experience that you're providing, or what kind of relationship that you're building with the client? That is very, very important. The person's experience relates to the relationship that you actually create with the person. So this is where a lot of efforts are put into making sure that there are systems to manage customers, what we call customer relationship management, CRM, loyalty programs. If you have bought a product from me, that means that you're already a customer, and that if I'm to have a product that I'm launching, you who has ever bought a service from me or a product from me, I may give you a discount, what we call loyalty programs. If you're already a student undertaking a program, let us say Bachelor's of Healthcare Management, and then you get interested in another program, let us say Advanced Certificate in Public Health, the amount you pay is going to be different from an outsider paying for that Advanced Certificate in Public Health. That is an example of a loyalty program. Having become my customer and I have a good relationship with you, what rewards do you give me for being your loyal customer? That's very important. You have seen corporations send messages to people. Let us say wishing someone a happy birthday. And that happy birthday message comes not saying or not addressing you as, "Dear esteemed customer, I know today it is your birthday, or we know that today it is your birthday. We wish you a fruitful day, or may the wishes of may your wishes come to pass." You see, he's saying that dear esteemed customer lacks the personalized element. If you say dear Simon, that has a personalized element. So that is where marketing is. It's more concerned about making sure you don't just push any information to everyone. People feel more happy if they really understand that the message is intended to them, not that a message is intended to everyone. There's a difference between that. That is what's called personalized communication. And that can happen if you have good customer relationship. So that was marketing generally. Now let's move to healthcare marketing. How has it changed over the years? Okay. Now in the 1970s and 80s, there was increase in healthcare marketing because of increase in number of specializations and advance in medical technology. So that means that the hospitals and health organizations wanted to know, they wanted to make sure that people actually know about these advances and these specializations in the medical field and the different services that are associated. So it was not very complicated. Basically, it was about sharing about these services through what we can call the traditional media: television, radio, billboards, and maybe community outreach programs. Now, when it came to the 90s and early 2000s, the focus now became more on the consumer. Okay? What we call the consumer-driven approaches. The experience, which I keep repeating, the experience of the customer while receiving the services in your health organization, healthcare organization, is very important. Okay? Issues to do with what you call patient-centered care are rooted in this, that the customer is the king and that his needs or her needs need to be fulfilled. And therefore, the focus was on patient satisfaction, delivering quality care in the most convenient way possible. Now we are living in an era of having what you call digital technologies to provide patient-centered care in the most safest way possible with the best experience. Best experience. The experience I'm talking about is the patient interacting with the healthcare organization and healthcare workers. How is that experience? Okay? So the digital transformations that have happened include online platforms, search engines, social media, mobile apps. We want communication to be two-way. I communicate to you, communicate back to me, because these platforms have enabled that to happen. If you want to buy a product online, one of the best strategies to use is to see what other people talk about the product. So you as the healthcare marketeer, you want the customers to write something good about you. Good testimonies, good online reviews. This is very important. People will make their decisions on whether to go to your facility or not based on what others have said about you. And this happens because of digital transformation. You cannot mistreat someone in your hospital and then they go back home and then you think you're safe. They will go back home and then post something on social media. And then you have a lot of problems to deal with. Crisis communication. You need to have you need to deal with the damages that have been caused. How are you going to respond to that crisis? Because it's a crisis. Okay? A mother takes a child for circumcision. The circumcision gets complicated. the child bleeds, and in the process of making sure that you really manage the situation and do appropriate, open, and transparent communications, you dismiss all this. The next time you see this woman writing about their experience about circumcising their child in your hospital, okay? So that is where the problems come in. However much you do the advertising, you will have that. There are organizations that I know that when they post content on social media, the comments are usually negative. So however much you make sure that you post good things about your services and the customer is not happy with your service, they will always write those negative things. You see what happens with the telecom industry. The telecom providers in the country, many people or many customers think they are being cheated. And however much these telecom companies actually make sure that they introduce new products, try to engage, still you see that the comments will be negative. And this is the era that we are living in. We are living in an era where feedback is instant. Instant. Someone goes for a dental checkup and then they say, Dr. So-and-so worked on me diligently. I'm very happy with the experience. The nurse was meticulous. Explained to me everything. This is where we are going. Or this is where we are now, actually. Not where we are going. We are going. This is where we are. Okay? Instant communication that is focused on the patient or the client who has used your services or products. So patient testimonies are very important, or the client testimonies are very important. When they write content about the services that you have received, it's very good marketing strategy. So people make purchases based on what other people have said, what we call online reviews. If I want to buy a medical product, let us say this digital blood pressure machine, if I can't find someone who has expertise in this device, then I'll go to the internet and say digital blood pressure machine, this type. Then you enter and then say reviews. You're saying that I want the reviews for a blood pressure machine called this. And then the people who have ever used that will come. I bought it the first time, it worked, but after 2 months, it got spoiled. Or the blood pressure machine is very efficient. It gives easy readings. That's a review. So after looking at all these reviews, then you make a decision whether to buy a product or not. That means you as a healthcare marketeer, you need also to do what you call listening. Listening is not only about hearing what people say, but searching on the internet to hear what people have said about you. That's listening. Digital listening. Social media listening. Do you listen? Do you interest yourself in what people are saying about your business? So that is the era we have. How do you even respond to people who have criticized your product. Someone may buy your product and then the product doesn't work as they expect. Are you available to explain why maybe the product didn't work? What other support services are you going to provide? So that's very important. And then because of the digital transformation, we have what you call data analytics. You don't just market anyhow. You need to know who you want to really buy your product. So healthcare marketing has got resistance. People are not aggressively marketing healthcare services. So people don't want to market healthcare services. Why? One is that they're established, deep-rooted traditions and cultural norms that make it very difficult for people to change their perspective about marketing because they believe certain norms should be respected within certain professions. For example, a doctor marketing it's not very, very common. So that is one of the reasons. The other thing is that marketing in healthcare can have what ethical issues. Ethical issues. It becomes very difficult to market a product, yet you know that this product may have some side effects that may affect the welfare of the patient. So, what do? It's a delicate balance. You want to be very truthful and you want to make sure that you have that trust with the customers. So what do? Do you market or you don't? So this is the other reason. Okay? Doctors and nurses value their professional autonomy and really they don't want to focus or to have efforts to market the services that they really provide because they perceive that as commercializing their work. Yet their work is basically based on clinical judgment. So they don't want to compromise their clinical judgment because of marketing efforts. Okay? A patient has come, you have done all the tests. You have determined that the patient needs dewormers. Okay? But you have conflicts on which dewormer to use. Not because of what is best for the patient, but because of where are you going to get more profit. So this is where clinical judgment versus profit making becomes an ethical issue. So that's why marketing is being resisted in healthcare. So trusting people is very important, and especially in healthcare. Okay? So there is a belief that marketing efforts lack transparency and are basically intended for selfish gain. They are self-serving. So people don't want to engage themselves in that. Okay? And then the heads of departments within the healthcare organization may be reluctant to invest in marketing. So you have categories of people. Go out. Close the door. So you don't want to You don't want to have conflicts within the hospital because the people have the varying perspectives, opinions about spending a significant amount of money on marketing. Others will say, I don't want to engage in marketing activities. Others will actually uh, promote the idea that marketing has to be done. But one of the issues is that you may not have the resources to do it. So are you going to devote your resources to marketing or to buy medical supplies? So it becomes very difficult for you to make that decision because you have limited resources. So it becomes hard. However, as we move forward, perspectives are changing. The situation makes you change. And there is increase in marketing health services. Why? Because new things are coming up. New technological advancements are coming up. And you need to make people aware. They should be aware of the new services and the products. And then also, if you don't market, other providers are entering to the market. So you're facing stiff competition. So why don't you market? And then the other thing is the increasing focus on the consumer is making the patient or the client more empowered, and they therefore need more information and clarity, and their issues or complaints need to be addressed in the most effective way, in a timely manner. So that means that you cannot avoid the fact that you actually need a marketing team. Okay? So that's the point. You have a hospital, you can't afford not to have a social media page. You can't. You need to have it. Whether it is Facebook, whether it is Twitter. Because people will want to engage with you. If they want to appreciate you, they have to. If they have to post their complaint, they will have to. So that is why marketing is increasing. Okay? But also, as healthcare organizations need to focus a lot on prevention. Okay? And this preventive care may not be known to the public. So for you to emphasize the availability of preventive care and wellness, it means that you need to invest in marketing. The other point is that the shift in the healthcare landscape, where targeted marketing is very important to attract patients. This is what is happening across most of the fields. You don't want to spread the resources anyhow. You want to know, or you want to increase the chances of your resources bringing more returns. If you are a high-end hospital, you can't market to the lower income class. You can't. You need to know the segment that you want to target. Okay? Marketing is very important, or is increasing because of issues to do with branding and reputation management. Okay? One way to market services is to have a very strong brand and reputation. Okay? So reputation is very key, because A good reputation will bring you the sales, bring you the customers. A bad reputation will chase customers. Even the few that you have will run away. Okay? And therefore, branding, reputation, these ones come into relevance because you have a number of healthcare organizations, but you need to stand out. You need to be unique. So what makes you unique is what branding. So you need to stand out. Okay? But also marketing in health services, in healthcare, is actually regulated. There are regulations enshrined in the laws, in codes of conduct, but different areas or places are trying to make sure that there is flexibility with the regulatory requirements in healthcare marketing. Okay? So these regulations are becoming more and more flexible. They can be modified. They are being modified. The other aspect is to aid what we call targeting. You need data. To aid targeting, you need data. So the integration of data analytics in healthcare has promoted marketing. Okay, has promoted marketing. And then the adoption of patient-centered care. This is like the norm across healthcare industry, that the patient is the king. So they have to be involved in the decisions about their care in a collaborative manner. So as you market healthcare services, you increase awareness about the services, you educate the patient. Of course, the quality of healthcare services will improve, promote preventive care. You foster trust and credibility and facilitate effective communication. So this is related to the what I earlier on said, that marketing is not only about selling a product. It's not only about selling a product or a service. Okay, so it drives more innovation and adoption, retaining talent. Okay, retaining top talent. I want to emphasize this. For you to get very good doctors, you need to do some good marketing and branding and issues like that. No good doctors will come to your fake hospital if the hospital is not managed well. No departments, no functional departments, no efforts to make sure that you stand out. No one will come to a hospital which is not really functioning well, or a hospital which is collapsing. Okay, so proper marketing will make sure that you retain top talent. Okay, if you ask yourself, which NGO could you want to work with? If you say the NGO, it means that NGO must be doing something unique that you think you should be associated with it. Which private hospital do you wish to work with? So that means that the hospitals should strategically place themselves to attract top talent. So if you have an organization which has been advertising for a gynecologist for the last 4 months and they have not got one, The organization itself will have to look internally and evaluate whether they are really whether their reputation is worth it, or they need to restructure and rebrand. Of course, the more sales come, the more revenue will be generated, and this will allow for sustainability and also investing in patient care. When we market goods, healthcare goods and services, we drive competition, and this will result into improvement in quality of care that we provide. Okay, so healthcare industry is quite unique. I keep discussing this over and over again, and also discuss this in the oral exams very often. What makes the healthcare industry different? What are the futures of healthcare industry? This is an important question to ask, and any healthcare provider or any healthcare manager should understand why the healthcare industry is unique. One, it is very complicated because there are a lot of processes, systems, regulations, different personnel with different specialities, different levels of management skills, different levels of technical skills. It's very complicated. It is highly regulated. Decisions that you make in healthcare industry pose a lot of ethical dilemmas. When it comes to the regulatory environment, you're regulated by the state, or let us say by the national government, regulated by the state, regulated by the local authorities. And then we have what you call councils. The Council of Nurses, the Doctors' Council, okay, the Council for Physicians, and the other allied professionals. So regulation is very tough in terms of licensing, in terms of the different categories, okay? So you have a very complicated system. And then the other unique character is the patient-centered focus, centric focus, which I've explained over and over again. The emphasis is on the patient care and well-being, and then safety. Okay. Other unique challenges include issues to do with medical research. If you want to develop a product, it undergoes through different testing and approvals, validation, licensing, and deployment. Very complicated processes. Okay. The other thing is the healthcare industry is unique because it deals with the most complicated issue. It's about life and death. So the stakes are high. When we talk about giving a patient given treatment, we are talking about giving them a chance to live or not to live. So it is unique. It's not like business. Okay? The other thing is, of course, I said that there are a lot of disciplines. You work with healthcare workers, and you also work with other people who are not healthcare workers, but are working within the health facility. Okay? So it becomes complicated because the alignment, professional alignment is not the same. They will look at issues not the same. A doctor will look at saving life. A financial manager will look at making sure that they make a lot of profits. So how do these people meet and have a compromise and see and devise a plan of moving forward. It's a challenge. And then the other issue is about continuity of care. You have a patient being tested in one hospital, being treated in another hospital, and then follow up in another hospital. How are these hospitals communicating and collaborating? And how easy can we make sure that the patient doesn't miss out any care because of the fact that they are being handled in different facilities? That is an issue of continuity of care or continuum of care. So since healthcare industry is unique, healthcare marketing is also unique. Okay. One is that the industry, the healthcare industry is very complex, like we have said. That means that you need to tailor your marketing, which is basically related to targeted marketing. And that one you now know. Two is that you have ethical issues that can arise out of health marketing. So you need to be very responsible in crafting your message. If you have a marketing message about ARVs, how do you package or how do you draft this message in a way that does not inflict psychological harm because of the sensitivity of the issue related to HIV? Very important. You need to comply with the regulatory authorities, which I said are very many and are different categories. High stakes because of the issue to do with life and death, where trust becomes very key, and also basing your care when the patient is actually involved. Diverse stakeholders are required for effective communication and engagement strategies. Okay? The other thing is that healthcare's impact on society demands thoughtful and targeted messaging. So you need to think before you spread messages out there. You need to look into the cultural norms and the professional autonomy that influence marketing. Remember, we said that marketing in healthcare is facing resistance, but also is increasing. So how do you make sure that you deal with the factors that create that resistance? It's the other issue. So information is usually very complex, sometimes very technical, but you need to communicate it to the targeted audience in a simplified and clear manner. Okay? So that's it. The next point is resistance, which I've explained, and then limited resources. You're starting a hospital, your interest may be in ensuring that the services are available, but if you forget to market the services available, you have a hospital which does not have clients. So when you talk about healthcare organizations, we talk about a variety of organizations, not only the hospitals that have been referring to. We have pharmaceutical companies, we have suppliers of medical products, we have insurance organizations, we have providers of supporting services. Okay, if you have a hospital, you will have other organizations supporting the hospital. IT infrastructure. Okay, so you may have an IT firm managing the IT in the hospital. Of course, the usual healthcare organizations that we know, hospitals, nursing homes, they can be specialist hospitals or general hospitals. Okay, they can be research firms, they can be There can be many organizations. Okay. So if you're going to look for work, these are some of the organizations that you have to look for opportunities. Not only hospitals, as we know. You can look for work in medical logistics organizations, in companies that produce health products, in pharmaceutical companies, and many others. Okay, so we have looked at the uniqueness of the healthcare industry. We have looked at the uniqueness of healthcare marketing. Now let us look at the uniqueness of healthcare goods and services. One is that for you to be able to render these healthcare goods and services, you need to have diverse medical knowledge. That sometimes requires specialization. So, healthcare goods are complex. Are complicated because they require that knowledge. Okay. These goods can determine the outcome of patients. So they are a matter of life and death. These goods need to be highly regulated, and we have seen the authorities concerned. Okay, the drug authority, the food, uh, pharmaceutical organizations, and things like that. The Bureau of Standards, all these are regulatory issues or organizations. The other thing is, in the provision of these services, there is access to sensitive information. So you want to make sure that this information, this patient information, is kept in the most secure way. Okay, developing a good, let us say a drug, takes long time and involves a number of research studies being conducted. So healthcare goods are complicated because of that, and they require collaboration amongst multidisciplinary health teams to develop. Okay, and then there is always focus on ensuring that there is evidence of the process of delivering services should be evidence based. And this evidence comes from rigorous research, such that we can really understand the effectiveness of these services. The things in the medical field are not the same throughout. They keep changing, so you need to be continuously learning and adapting to new advancements. Okay, and then these services and goods can be provided in a number of settings. Okay, medical care or healthcare services and even goods are provided in hospitals, pharmacies, nursing homes or home care homes, medical centers, a number of settings. Okay, and then of course there's a complicated issue to do with cost and the resources available. You want to make sure that the patient becomes well, but at what cost? And what resources do you have available? So it's quite delicate. So it involves balancing between patient care with cost effectiveness and resource allocation. So what are the implications? Tailored or targeted marketing is becoming common. You want to invest where we'll get good returns. So that is why tailored marketing approaches are very important. And also focusing on patient experiences, what we also call the patient-centered care or patient-centric approaches are very key. Okay. Then when it comes to tangible products and intangible services, remember in the healthcare setting, the goods are the ones that are tangible. It could be the blood pressure machine, it could be the glucometer, it could be the bandage, whatever it is. And then the intangible services, someone who has gone for a cesarean section. Okay, these are intangible services. So how do you promote this? Okay, emphasize the features of the goods, the functionality, what the good can actually do, and then what are the likely health outcomes for using the goods. That means you really need to build expertise, trust, and be able to provide personalized care. So these are the things that are needed. Okay? So if you are a surgeon, you need to be extremely competent. And that is when people can now trust you. And that is when you can actually provide personalized care. So how do you develop that edge over others? If you have a group of if you have in one locality you are providing medical services at the same level, let us say secondary care level, how are you going to create at that edge? Be innovative, use technology to enhance effectiveness, but also technology allows you to make very good decisions about how you can manage, how you can market, and what things need readjustments. Okay, so that marks the end of this presentation. It's time for questions.